This video is on heart sounds, and it's part of the laboratory experience for Biology 282. And since you have a stethoscope in the body, you can listen to the heart sounds. So you can actually do this. So what causes the heart sounds are the closing of the valves, and we'll see which valves cause which heart sound. There's two heart sounds. They're designated S1 and S2. The first heart sound is the closing of the mitral valve. That's also known as the bicuspid valve on the left side of the heart, and the tricuspid valve. These are known as the atrioventricular valves because they're between the atria and the ventricles. This happens at the beginning of ventricular systole. The fact that the ventricles are starting to contract increases the pressure in those chambers, and it closes the valves behind them. Okay, so it's loudest at the apex and over the left sternal border. The first heart sound can usually be heard easily with both the bell and the diaphragm. You have two ways to listen: to put your stethoscope on the bell and the diaphragm, and you can hear the first heart sound with either part. The second heart sound, S2, is the closure of the semilunar valves, the aortic semilunar valve and the pulmonary semilunar valve. And this happens at the end of ventricular systole, when the ventricles are starting to relax. And it's loudest, it can be heard loudest at the base of the heart. Remember, the base of the heart's at the top. For the second heart sound, the diaphragm is used with the stethoscope, and it's usually placed at the base of the heart. Okay, so those are the heart sounds, and they occur what? When the valves are closing. When the AV valves close, the atrioventricular valves, the bicuspid, tricuspid valves close, you hear the first heart sound, and you hear the second heart sound when the pulmonary and aortic semilunar valves close. So here they are. The first one is the closing of the mitral valve and the tricuspid valve, okay? And then the second one, that they don't put it here, but it's at the closing of the aortic and pulmonary semilunar valves, and they're designated S1 and S2. Now, let's think about if you've ever taken your pulse or ever listened to your heart. The heart does not beat like this. Wow, the aphasia between the screen and my hands is terrible, so it's not working at all. So what I'm going to try to do is I'm going to try to bang on something over to the side. Okay, you can hear that. Okay, your heart does not beat like this. It beats like this. I hope you can hear the difference. Not like that, like this. That's why I like Latin music so much, because it goes in that heartbeat fashion rather than a 1, 2, 3, 4. It goes 1, 2, 3, 4. 1, 2, 3, 4, rather than 1, 2, 3, 4. Sorry, the hand clapping thing did not work at all. Okay, listening for heart sounds, it requires 4 exact anatomical locations. This physician is not putting that stethoscope in a random placement. That's a very exact placement. And you'll see on the slides that follow how exact of a placement it is. There's 4 exact anatomical locations, and that's an exact anatomical location, and you'll see it on the diagrams coming up. See, she was over there in the pulmonary semilunar valve location. She's listening right there. The aortic semilunar valve is up here. You want to hear the tricuspid, it's over here. and you want to hear the mitral, it's over here. The tricuspid and the mitral seem right because this is toward the right side and this is toward the left side. The aortic and pulmonary look backwards, but if you look at the heart, that's the way it is. Okay, so the aortic is on the left side of the heart, but it's crossing over, and the pulmonary is on the right side of the heart, but it's crossing over. So aortic location, pulmonary, tricuspid, mitral location, right over where those valves are. See, here they are. You can see it better here, even better, because now we got the ribs, and it really is the ribs that give you the location. You see this placement for the aortic is between the second and third ribs on the right side. For the pulmonary, it's between the second and third ribs on the left side, okay? And then for the tricuspid, it's down here. And then for the mitral or bicuspid, it's over here between the fifth and sixth ribs. So to hear those heart sounds really good, you have to place the stethoscope not in a random position, but in a very exact anatomical location. This is for the aortic, this is for the pulmonary, this is for the tricuspid, this is for the mitral or bicuspid. And now we come to the conclusion. The heart sounds tell us about the regularity, the rhythm, the consistency of the heart. And the reason why the heart valves have to be functioning properly is because they prevent backflow. That's what those valves are. You don't want blood going backward in the heart because that leads to a vast inefficiency. And that inefficiency will overwork your heart. It'll make the heart age faster. And so it's very important to be able to listen to heart sounds in exact anatomical locations and know what they sound like and know what's normal and know what's abnormal, because you can help the health of your patient if you spot a valve problem early. Then it can be fixed and won't cause as much damage as if it goes on for a long period of time.